As you can see, condoms are readily available at your local grocery store.
So can you get tested for STIs here?
STDs? Yes,
Yes.
you can.
Okay.
There's a place in Banff which is free for STD testing. However, they are closing at the end of the month. So for now, this clinic and other clinics in Canmore will be the only ones.
So here at the Ridgeview is one of the many different places you can get STI testing and options for birth control. And it's easy. So do you guys provide like Plan B or?
Plan B we provide, but a person has to be aware that Plan B isn't actually birth control. It's birth control is something that you would use technically as a preventative measure.
Yeah.
So Plan B is just as the name implies, it's sort of a backup when your Plan A hasn't worked, right? So you don't need a prescription for it. Different pharmacies will make access different. Some places they'll have it over the counter where you don't need to speak to the pharmacist. Here, if you pick it up, you need to speak to the pharmacist. You don't need a prescription for it, but it just means that we take the time to go through things that we think are significant related to the use of the Plan A. Okay. Regular hormonal contraceptive like birth control pills and that sort of thing, you still need to see a doctor for. Important thing to note with sexual health and all matters of health for that matter is confidentiality applies. So once you are, with most prescriptions it's over 14 years of age. With regards to sexual medications and that sort of thing, I think it might actually be even younger, where if you go and see a doctor, no one else needs to know about it. That's your right, your privacy.
So with that, would you believe that having a sexual health clinic built in our community would be a good thing or a bad thing?
Well, I'm not really sure what the statistics are right now in terms of how well educated people are with regards to things that might be significant in terms of sexual risk and that sort of thing. I think the schools do a pretty good job of that, but I mean, it's a touchy subject for a lot of people, a sensitive issue. People might not be asking the questions that they need to ask in order to get the answers they need to make responsible decisions with. So I think people should have access to that information, and if a clinic would help, then I think it's a good idea. If it's redundant, then obviously not.
And do you believe that people in our community have enough resources around the town already though?
I wouldn't say that because I'm not really sure what resources are available. I'm sure through public health there are resources. I wouldn't be surprised if there are through access indirectly to social services or school systems, that sort of thing. I mean, pharmacists are available as resources as well too to answer a lot of the questions. And like I say, as long as a person can get in to see a doctor, which isn't always easy, then they're really on the front lines as well. And in town, as opposed to the cities and a lot of other places, they're usually fairly accessible. Yeah.
Hello there. Oh, the camera angle changed. Well, here at Camera Collegiate, there's a lot of things that can help you with decision making and sexual diversity. Well, there's a school counselor that is here all the time, so you can talk to them.
You can talk to your parents about just about anything, and they can help you make sexual decisions. If you decide to keep your child, your parents can support you either financially or emotionally.
If you need help with healthy relationships and dealing with relationship conflicts, there's people like Pam and people like Miss Symington that you can go to for help.
Here at the hospital, you can get checkups for STIs, as well as you can. They do have psychologists here that you can talk to about sexual diversity. The hospital is a place that you can go to for abortion if that's your choice when you get pregnant. When you're pregnant, if you do choose adoption, you can talk to Miss Symington, as well as probably the counselors at school, and I'm sure the hospital will be able to assist you and set up an adoption plan and pick your own parents. As you can see in Canmore, we have all the resources, places to go, and people to talk to about sexual health. And that's why me and Patrick believe we do not need a sexual health clinic. And we believe that the money could be better spent somewhere else.